Good evening, Rob. Thank you so much for all of your help tonight. And good evening to all of you. I want to say welcome and thank you for joining our telephone town hall on California's coronavirus response. We're currently 623 strong on the line. Tonight, we're going to be having a special focus on the county of Sonoma. Again, my name is Mike McGuire, and I'm honored. I'm honored to work with you as senator here on the North Coast. The most important part of tonight is hearing from you directly. We're going to spend as much time possible answering your questions in real time. Send us questions and comments to senator.mcguire@senate.ca.gov. We're taking your questions now, live on the line, senator.mcguire@senate.ca.gov. We have an outstanding panel joining us tonight, and before we get into this evening's town hall, I'd like to be able to make a few brief opening remarks. I have to say, Sonoma County, thanks to the incredible work of so many, Sonoma County has done a wonderful job at containing this virus and reducing the expected surge of patients and deaths due to the pandemic. Sheltering at home and social distancing, well, it's kept us largely healthy and it's kept us safe. These actions have literally saved thousands of lives throughout our region with the shelter-at-home orders. That said, this has been an unprecedented and awful 2 months for so many. Sadly, the best thing for public health, because we don't have a vaccine or a robust antibody test, has been the most challenging for our local economy. But things are starting to change. Testing is becoming more available through the state, which will give us a better data set to rely on regarding the virus and how it's impacting our county. Because of the sacrifices of so many, and with the increased testing, we are now beginning to safely and strategically open back up for business. Health officials and business leaders are working together like never before to keep us safe as the reopening process continues. But let's be honest, it's going to be a long time before business looks like it did just 3 months ago. For the foreseeable future, we're going to be wearing masks. We're going to have to keep our distance from each other. We're going to have to stand behind plexiglass at the grocery store, and we're going to need to postpone all large gatherings, a minimum through the summer. The reason? A vaccine is still at least a year away. We're going to hear more about that in just a bit from Dr. Brewer from UCLA Medicine. And there still isn't a robust federal testing program. And the antibody tests that we keep hearing about, we're going to be candid with you tonight. Those antibody tests simply aren't ready for prime time and mass distribution. But here in California, we're working together day and night to be able to resolve these issues. We're going to do a deep dive into the virus this evening, focusing on public health and safely and strategically reopening our economy. You can't have one without the other. Our economy, in order to safely and strategically open it back up, is going to be dependent on public health. I believe that we're starting to see the light at the end of the tunnel, and we need to keep heading in that right direction, and I know we're going to do it together. Please know that we're going to be here for you now and here for you in the months and years to come. I would now like to be able to transition and go over the flow for this evening and introduce our speakers. We're going to be getting an overview of the coronavirus, what we know now and where we're going from Dr. Brewer. Dr. Brewer is from the UCLA Geffen School of Medicine. He's going to be focusing on testing across the state. He's going to be focusing on a potential second peak in the fall. Will that happen? He's going to give us his best estimate on summer. Are we really going to see a dip in cases over the summer? And, of course, he'll be talking about a potential vaccine and what that timeline may be. We're grateful that we're going to be joined by the public health officer from Sonoma County, Dr. Mays. She'll be providing us an in-depth report in just a few moments. We're then going to be talking business with the Sonoma County Economic Development Board Executive Director, Sheba Person-Whitley. She'll be on the line talking about what are and what should businesses be doing to prepare for a full reopening. And then we're going to have the premier Bay Area economist on the line tonight. He's from Sonoma State, and his name is Dr. Robert Eiler. He'll be giving us a full economic forecast. And, of course, we'll be taking your questions and comments live on the line. But before we do, we now would like to be able to start our telephone town hall and turn the floor over to one of the best infectious disease docs here in the Golden State. His name is Dr. Brewer. He's been with us almost every week since the start of this virus. Dr. Brewer, we welcome you to the town hall. The floor is yours for the overview of the coronavirus. Welcome, sir.
Thank you very much, Senator McGuire. I'm delighted to be able to join everybody again tonight. And what I'd like to start with is just the announcement that the World Health Organization made today of the highest single-day total of cases reported to WHO. And the point of that is just to remind us all that while things have been moving in a positive direction in the United States and in California, this virus is still with us, and it's going to stay with us for a while. Your sacrifices have made a tremendous difference, and I'm going to briefly touch on those. So globally, we're talking about 4.8 million cases, about 320,000 deaths, or a case fatality rate of about 6.1%. About 30% of all cases in the world have occurred in the United States. So we have about 1.5 million cases and just over 91,000 deaths. And so we are contributing, unfortunately, to a large percentage of the total burden of COVID in the world. But as we see in India and Brazil, it's likely to be increasing its spread elsewhere. This still remains a disease primarily of adults, especially older adults with comorbid disease. So in the U.S. as a whole, adolescents and children under the age of 18 just represent about 3% of all the cases. So you may have been hearing about these unusual cases of multi-systemic inflammatory disease. That is still very rare. And most children, most young adults, people under the age of 50 have mild to moderate disease. And it's really our older populations that we have to worry about. Here in California, we have about 84,000 cases, about 3,400 deaths. Our case fatality rate is 4%, so it's below the national average. And I just want to point out that the county with the highest case rate is Imperial County, here down here in Southern California, but that is 3 to 8 times lower than numerous counties in New York, New Jersey, Louisiana, Georgia. A clear testament that the stay-at-home orders, the terrific work that Dr. Mays and the senator and others have done, and your sacrifice has made a tremendous difference. Our case rates are much lower than many other states across the country, and you really should be congratulated for that. In terms of who's getting it, well, we see that more Latinos are getting it than are represented in the population. So they account for about 39% of the population, but about 54% of the cases. More African Americans and blacks are unfortunately dying, as well as Native Hawaiian and Pacific Islanders. And so we still have some work there to do. What to expect in the summer and the fall? Cases will likely continue to go down as long as we remain smart about our physical distancing, our staying home when we're sick, our washing our hands, and using our facial coverings. Just the natural being outdoors and spread out should lower case rates in the state if we remain smart, but we will likely see a surge in the fall and the winter, and we can talk about that in the question and answer. You may have heard a couple of days about a company called Madeira and a vaccine. That's a phase 1 trial. That just means it's a study to find dose and safety. And the good news is it does seem to be both safe and to create antibodies. And so now they're going to move on to what are called phase 2 and phase 3 trials. But as the senator said, we're probably at least a year away from having an effective vaccine that we can start handing out to people. Antibody testing is rolling out. There are some effective tests out there, but they're primarily based in hospitals and commercial labs, the kinds of tests that you can do in the home, as the senator has said, probably not as reliable as they could be. If you think you need to be tested, you should be talking with your healthcare provider. And then finally, I just want to touch base about hydroxychloroquine, a medicine that's used to treat lupus and malaria. You may have heard about it being used for COVID-19. There are no data, absolutely no good data, to say that hydroxychloroquine is effective to treat COVID-19. We are studying it, as many groups are across the country, but you should not take hydroxychloroquine without talking to your healthcare provider. It can cause heart disease, both arrhythmias and heart failure. So this is a drug that should only be taken under the supervision of a physician. So I think I'll stop there, Senator, and I'm looking forward to the question and answer period.
Dr. Brewer, thank you so much for that in-depth overview of the coronavirus. We're going to be getting to Dr. Brewer in just a few moments for questions and comments. If you do have any comments, if you have a question, email us now, senator.mcguire@senate.ca.gov. We have several folks who are trying to be able to get on the line, and I apologize, but we've hit our 1,000-person limit, so we'll be posting a full audio recording tomorrow on our website. But we're now over 1,000 strong on the line. We're going to be turning it over now to the public health officer. Her name is Dr. Mays from the county of Sonoma. She'll be providing us a confirmed number of cases in the county. She's going to be giving us a testing update. She's going to be touching on race and ethnicity. Who is this virus impacting the most across the county? And she's also going to be talking about how those decisions are made to be able to reopen and what data points she works with locally and, of course, working in conjunction with the California Department of Public Health. We're going to turn it over now to Dr. Mays. Dr. Mays, you have 4 minutes. We'll give you a 30-second prompt. Good evening, Doctor.
Great. Thank you so much, Senator McGuire, and nice to be on. So for our update, let me start with what's going on today. We have 411 confirmed cases, up 20 in the last 24 hours, and we expect another about 20 cases today. Of our 411 confirmed cases, half are active, half are recovered. We have 4 deaths that have been recorded so far, and we've done 15,912 coronavirus tests to date. A little bit about our cases. The majority are occurring in the central county, about 63%, and we have about half and half in men and women. As far as an age distribution, we're still getting the majority, about, I would say, 3/4 of our cases occurring in those 18 to 64, about 12% in age 65 and above, and 16% in children under the age of 18. The majority of our cases are still happening in close contacts, but we have been seeing more cases in community spread in the last week or so, and that we expected due to relaxing some of our shelter-in-place restrictions. As far as the race and ethnicity, which I really wanted to touch upon, we are finding very sadly that there's a great disparity, and 64% of our cases are occurring in those people who describe themselves as being Hispanic or Latino, in other words, the Latinx population. And about 30% are happening in those who describe themselves as white, non-Hispanic, 5% in Asian or Pacific Islander. And what are we doing to address this disparity? Well, we are putting out a lot of messaging for that community, targeting testing and providing testing for the Latinx community, working with community leaders to ensure that we are providing outreach in Spanish through the radio stations and other communications. So about testing, we're having more cases partially because we are doing more testing at this time. We do have the capacity now to perform close to 800 to 850 tests a day in the county. Our state-funded testing centers, called OptumServe testing centers, are located in Petaluma and Santa Rosa and are able to provide now about 260 tests in each site for 520 total tests a day. I'm glad to say that everybody out there is taking advantage of this and calling to make an appointment with OptumServe. Now, we also have testing through the Sinead Laboratory, and that's the public health testing site. We're able to do 200 to 250 tests a day. And in this site, we're really prioritizing the groups that are highest at risk, like healthcare workers, first responders, people over age 65 who are symptomatic, our essential workers, and we are continuing to take appointments for that testing. In addition, our hospitals and clinics are also testing themselves, so we are up to about, I would say, 800 and 850 test capacity at this time. And why is this so important? Because testing capacity is one of the criteria for reopening. Now, as of last week, the state of California changed some of its metrics, and now we are meeting the criteria in terms of the percentage of our tests that are positive being under 8%. We're about 3% average, and not having more than 20 people hospitalized in any given day in the past week. So given that we meet these criteria and others, we are moving towards aligning with the governor's staged, phased reopening plan, which we can discuss more in detail. We do have some good metrics, though, for when it is we would start to look at further restrictions moving forward, which we can also discuss in the question and answer period. Thank you.
Thank you so much, Dr. Mays. We are so grateful and appreciate you being on the line. We're going to be hearing more from our speakers here in just a bit. We're going to be asking each of our speakers to please mute the line. We're getting a little bit of feedback, and just reminding our speakers to be able to pick up your phone off of speakerphone. We truly appreciate you and your assistance with that. We're now going to be turning it over to Sheba Person-Whitley. She's the Executive Director of the Sonoma County Economic Development Board. She's going to be providing us what are and what should businesses be doing to prepare for a full reopening. She also will be talking to us about a potential timeline and outlook for reopening more businesses in the county. She has been incredibly busy preparing those businesses to be able to open up safely and strategically. Ms. Person-Whitley, we welcome you. You have 4 minutes, and I'll give you a 30-second prompt. The floor is yours.
Thank you so much, Senator McGuire. So Economic Development Board of Sonoma County has been very busy supporting businesses with resources and helping them think through how to mitigate and prevent the spread of COVID-19 as we reopen. We've pulled together a number of industry-led work groups, and so that came together very quickly. We had a ton of support and over 100 volunteers that met virtually to think through mitigation measures. We know that as we move towards this reopening, a phased approach, that is not going to be a light switch. You're not going to be able to just go back to business as usual. But we also recognize the fact that we have a very savvy business community. As much anxiety and angst there is out there, there's just as much consideration, care, and concern of how we can do this in a very thoughtful way and take the safest approach possible. So on the Sonoma Economic Development Board site, you will see business mitigation measures. Those were developed by industry, not by us, so everyone is thought through how they can meet mitigation measures, how they can ensure that they have a safe environment, not only for their staff as they're re-entering the workspace, but also for the community and consumers as well. In terms of timing, we know that everything is happening as quickly as it possibly can and as safely as it possibly can. We do have a new health order that went into effect this past Friday. I know that the county has applied for a variance. We're going to see further reopening. Here at the County of Sonoma, we are staying in alignment with what is coming out of the governor's office. We are in phase 2 of reopening, and I do anticipate that we are going to move further into phase 2 within the next week. And with that, I'll keep it brief because I know we want to get to the Q&A. Thank you.
Ms. Person-Whitley, thank you so much for joining us. Now we're going to be talking about a look ahead. What will this virus do for our economy? We know so many are struggling out there, and to be able to provide us with an economic forecast for Sonoma County and beyond through the Bay Area and the state of California, we have one of the best economists here in California on the line tonight. His name is Robert Eiler. He's a professor and an economist at Sonoma State University. Dr. Eiler, the floor is yours.
Thank you, Senator, and thanks everybody for coming on tonight. The latest forecast for the U.S. is coming from the Philadelphia Federal Reserve, and it's suggesting that in the second quarter of 2020, unemployment for the nation might hit a number as high as 16.1%. It is currently at 14.7%. There's about 20.5 million people that lost their job in April, and those kind of numbers ultimately transmit themselves down to our area. One industry in specific that we know is hurting also locally is leisure and hospitality, which includes a lot of our attractions, our hotels and restaurants. 47.2% of the folks that were working in those industries in April 2019 have lost their job in April 2020 nationally. One local number that we're watching closely is the new claims for unemployment insurance. And in the last 2 months, the 6 counties of the North Bay have seen 148,000 people approximately going into EDD and asking for unemployment benefits. And in Sonoma County, that number is 54,000. Now, both those numbers are more or less around 20% of the labor force in the last 2 months. So we're expecting relatively high unemployment rates in Sonoma County when the data are announced on Friday. Now, how are we going to see that number change when we open? Hopefully business and consumer confidence will start to take over along with the fiscal stimulus that's taken place, low interest rates, and we'll see if those policies engage and take us where they need to go. Now, thinking forward of where we might be going as an economy, and specifically in Sonoma County, those forecasts going through 2023 from the Philadelphia Fed suggest it might be 3 years after 2020, or it'll be the end of 2023 where we start to approach the same growth rate in GDP that we expected to have going into this year and toward 2023, and unemployment might only be down to 5.1% nationally, where it started just under 4% as 2020 began. So for California, the Department of Finance, which connects to the recent budget revise we saw come out of the governor's office, they're not expecting a return to normal until maybe 2024. So there are some tricky forecasts out there about the length of time we're going to be in the situation, but so much depends on how we open and how robustly we grow after that. Thank you.
Thank you so much, Dr. Eiler, economist, Sonoma State University. Ladies and gentlemen, we're going to be getting to your questions and comments, and they are flowing in literally dozens at a time. We're over 1,000 strong on the town hall tonight. If you do have a question or a comment, senator.mcguire@senate.ca.gov. We look forward to hearing from you. We're going to get right into your questions and comments, the most important part of this evening. The first question is going to be for Dr. Brewer, UCLA Medicine. This is coming in from Anton from Santa Rosa. Dr. Brewer, Anton says there are 14 sailors on the Teddy Roosevelt who had the coronavirus 14 days ago and just retested it and are positive again. Anton says, I thought this couldn't happen. Can you please address this?
So, Anton, I haven't seen the data, but what is probably happening is they have a positive NP swab or a polymerase chain reaction test. And what we're seeing that people can remain positive for weeks after they have recovered from infection. So remember, this test is looking for pieces of the virus. So even if the virus is dead and destroyed, if there are little pieces still present in the nose, then the test might pick them up. So it does not mean that they were reinfected or the infection went away and came back. It just has to do with the fact that we have these very sensitive tests capable of picking up even small pieces of dead virus.
So, Dr. Brewer, I'm going to expand on that. So if an individual tests positive and or shows symptoms and has the virus, is it possible for an individual to get the virus again? Your thoughts?
So right now we have no data to suggest that people get infected more than once. We do know, particularly from studies in New York, where they've had many more cases than we've had, that people can remain test positive for many weeks, as much as 21 days after or 28 days after they've gotten all better. But we do not think that that's ongoing infection. So as far as we know, no data to suggest that anyone's had this infection more than once so far.
Thank you so much. That's Dr. Brewer from UCLA Medicine. We're now going to go to the public health officer for the county of Sonoma. This first question for Dr. Mays is coming in from Rosemary. She's a registered nurse. Dr. Mays, here's what she says. Rosemary has requested a test, and she has said that the county and the state have made claims, and it's true, that anyone who wants a test at a state testing site will not be charged. But when Rosemary called her insurance company and asked if they will pay for this, her insurance company said only if she has a prescription or the signature of the RN or LVN who takes the test signs the form. if you can please clarify for Rosemary, and I'm sure so many others on the line, what's the truth on that? Because a lot of folks don't want to be on the hook for a bill. Dr. Mays.
Yeah, thank you very much for the question, Rosemary. We actually do have free testing through OptumServe. You do not have to go through your insurance. You don't need to show any prescription. You can actually just go to our website, which is SoCo Emergency, and look up under testing what the locations are. For the OptumServe, I can tell you right now, you can go to a website, lhi.care/COVID testing, or you can call 888-634-1123. Again, that's 888-634-1123, and book an appointment. And there will be no charge or no requirement for a prescription.
Dr. Mays, how long should someone expect before they can get an appointment? Is there a queue of folks who are in line on a daily basis?
Yes, and in fact, there's been an incredible demand for the OptumServe testing. So we have actually added 2 lanes, in other words, doubled the capacity for OptumServe testing as of Monday. So hopefully, anybody who wants an appointment can get one within a couple of weeks at this time.
Thank you so much, Dr. Mays. We're going to be sticking with you. Dr. Mays is the Public Health Officer for the County of Sonoma. This next question is coming in from David from Windsor. David asks, why is Sonoma County so ready to jump at opening the county so quickly? Dr. Mays.
Well, I want to reassure people that we're not jumping at reopening, that we are simply aligning with the governor's plans, and they're based on data. In other words, we meet the criteria for reopening at this point in terms of the percentage of our tests that are positive and the fact that we don't have a lot of hospitalizations. And we're opening with a really good mitigation plan, as Sheba has already spoken to. So we're going to more low-risk activities, outdoor activities like the parks, for example, or coming to maybe summer day camps for kids. And then as we open, we'll make sure that it's in a risk-stratified way and that we have screening of employees at essential businesses every day, every shift, to make sure that they don't have a fever or any symptoms, that we evaluate people immediately if they do, and that we use all of our mitigation measures, such as the physical distancing and the hygiene measures, et cetera. So we're trying to do this in the safest way possible.
All right, Dr. Mays, we're going to have one more question for you, then we're going to go back to Dr. Brewer. You mentioned the issue of summer camps. We're getting a lot of questions about summer camps tonight. Heather from Windsor writes, what are you doing to help summer camps be possible and get our performers at summer camp back on stage? Do you anticipate kids' summer camps will be happening this summer in Sonoma County? That's coming in from Heather from Windsor. Dr. Mays.
Yeah, so let me just add one more thing about our triggers for going back to more restrictive measures so that I can just reassure people that we are following 12 different metrics for our reopening plan, and if things look like they're going south and we see that there's some alarms or red flags, we'll certainly reinstitute measures to protect the community. That's one thing I want to say. About the summer day camps, there is a process in place with the state of California for us to ask to reopen certain areas if we meet the criteria that I mentioned before. And since we do, we have asked the state of California about the ability to open summer day camps and for children, following the same strategy that we have with child daycares right now that are open. And we're waiting to hear from the state of California. As soon as we get approval, then we can move forward and work with our collaborators and our stakeholders to start looking at opening summer daycare programs for children.
I appreciate that, Dr. Mays. And Dr. Mays, please push back on me, but I think one of the items that the state is continuing to evaluate is how to be able to usher in these day camps that may have dozens, if not a few hundred kids socially distanced. And I think that's been the area of how that can be ushered in safely. Feel free to push back on me, Dr. Mays, on that issue.
No, it's a very good question that you have, Senator McGuire. And in fact, we are going to be limiting the numbers of kids can be in each day camp initially, for sure, to less than 12, groups less than 12 together with the same adult chaperones for the duration of the summer day camp. There can be numerous different groups of 12, but we're going to try to start with that strategy like we're doing now for child daycare. Again, if approved by the state of California, we will be okay with moving forward with that strategy.
Thank you so much. That's Dr. Mays, Public Health Officer. We are now, for the County of Sonoma, we're going to go back to Dr. Brewer and then also tag team with Dr. Mays on this next. We have two questions. We're getting a lot of questions about reusable grocery bags tonight. We're going to first go to Dr. Brewer from UCLA Medicine and ask Gustavo. Gustavo's emailing in tonight from Windsor. Are reusable grocery bags more contagious than single-use bags when it comes to the coronavirus? That's coming in from Gustavo in Cloverdale. Dr. Brewer.
So, Gustavo, it depends a little bit on where the bag has been. So, coronaviruses can survive on surfaces, usually in the order of minutes to hours, though they have survived as long as 3 days or more under ideal conditions in the laboratory. If you have a single-use bag in a grocery store and somebody has COVID-19 and they're in the grocery store paying their bill and they're coughing or sneezing, they could be contaminating those single-use grocery bags. If you have a reusable bag and you bring it in, and then when you bring it home, you wash it, and then you bring it in again, it's probably unlikely to be contaminated. So there's nothing special about reusable or non-reusable. It's just a question of where the exposure is happening. At least in LA County, they are discouraging us from bringing our reusable bags. So at the moment, we're relying on the single-use bags from the stores.
Thank you so much, Dr. Brewer. Yeah, same here in the North Bay area, only using single-use bags. And this is going to the next question from Lori. We have a lot of questions, Dr. Mays, Public Health Officer, Sonoma County, similar to Lori's. When do you think the ban on using one's own shopping bags will be ended? Dr. Mays.
Yeah, I think these are questions that will become really clear. The answers will become clear over time. At this time, we're still in a place where we're monitoring the numbers of cases that we're getting to see if we have more community transmission. And when we have cases, we do investigate where they may have gotten COVID from. We ask about grocery stores. We ask about other essential businesses. We ask about construction. We see if they've been to the park or park restrooms. So I think the answer to very specific questions like that will become more clear over time.
Dr. Mays, we're going to stick with you. Want to talk about contact tracing and privacy laws. This is coming in from Dan in Mendocino County. How can the county effectively contact trace with privacy laws such as HIPAA in place?
Well, we don't identify anybody in the process. In other words, we interview the person who has COVID, and we ask them who they've come in contact with over the time of their infectious period. When we reach out to the contacts, we don't identify who is the case, whom they could have been infected from. We don't turn around and, tell anybody the names of any individuals. Even if we were to reach out to, let's say, an employer, we would say, you've had a case of somebody with COVID, and therefore we need to talk to the following other people or test the following people in your business. Or we wouldn't use people's names. And we offer the contacts the test. They can refuse testing if they want, but we highly encourage that everybody gets tested who we think it may be at risk. We do have a health officer order for isolation of cases and quarantine of contacts, however, to ensure that we are making the community as safe as possible for everyone.
That's great. 20-second answer, real quick. Follow up on that. 20 seconds, Dr. Mays. Just describe contact tracing and the importance.
Yeah, so the people who are most likely to get COVID are those people who are close contact to someone with COVID. So we reach out to them. We ask them a series of questions, make sure they're not symptomatic, get them tested even if they don't have symptoms, and follow them daily, asking about their symptoms and how they're doing for 14 days, which is the period of time within which they may become a case of COVID.
Thank you so much. We are now going to be going to Dr. Eiler from Sonoma State. Dr. Eiler, Eric is asking, what is the worst case scenario and what is the most realistic scenario for Sonoma County's economy in the coming 2 years? Dr. Eiler.
The worst case scenario is that we will have a repeat of a housing market problem because there's a longer duration of unemployment than we expected, and that leads to people considering leaving their homes and going some other place and trying to find work. If that assumes that Sonoma County is somewhat isolated in that phenomenon, but that would be kind of the worst case. The best case is we turn relatively quickly, and by the end of 2021, we feel like we're very much on the path of getting back to the original baseline we thought we would be by the end of next year.
All right, we're going to stick with Dr. Eiler. This next one is coming in from Robert. Robert is saying that the president recently said that there will be the biggest growth in the economy in 50 years by the end of this year. Is that true?
It is likely that we will see some relatively strong growth rates in the economy in the third and fourth quarters of this year, but that'll be after one of the worst quarters in recorded history. So on a percentage basis, that's true. On a reality basis, in terms of compounding and where that leaves the economy, it's still not going to help very much. We are seeing forecasts that do suggest amazing growth in quarters 3 and 4.
And that amazing growth is because we're coming back from the crater, right? I mean, it's because the economy has just cratered so deeply. Would that be accurate?
Yes, that's a great way of characterizing it. When you think about, growing from 1 to 2, it's relatively robust growth versus 2 to 3. So when you fall very far, it's relatively easy to see strong percentage change coming back up.
Thank you so much. That's Robert Eiler, lead economist, Sonoma State University. Appreciate that. We're going to be going back to Dr. Mays. Send in your questions, senator.mcguire@senate.ca.gov. We want to say thank you to Emily and Carrie who are working the questions. Dozens are coming in right now. senator.mcguire@senate.ca.gov. Dr. Mays, this next question is in regards to Latinos and the coronavirus, coming in from Raquel. Raquel asks, what are the efforts Sonoma County is doing to decrease the Latino cases, and how soon after the efforts are implemented will Latino cases go down? That's coming in from Raquel. 60 seconds, Dr. Mays.
Yeah, thanks for the question. We are extremely worried about the disparities that we're seeing in cases, especially in the Latinx population. And as I mentioned, we are doing community outreach, education through the Spanish-speaking radio stations, through town hall meetings that are translated in Spanish, encouraging people to come in for testing and providing testing every weekend specific to the Latinx community in locations that are easily accessible so that we can get people tested and get their results back. We're also performing intensive contact investigation and testing around cases in the community as well. And we hope that with this, we'll initially start detecting many cases. So we may not see a downward trend right away, but with our efforts, we're hoping that to stem these disparities in the long term.
Thank you so much, Dr. Mays. We're now going to go to Dr. Brewer from UCLA Medicine. This question comes in from Steve. Steve says, I have no interest in receiving a vaccine. Is there any information you can share about how natural immunity might work? That's coming in from Steve. Dr. Brewer from UCLA Medicine, you have the floor.
So, Steve, the way you would acquire natural immunity is by becoming infected with COVID-19 or the SARS-CoV-2 virus. If you happen to be one of those individuals who has mild to moderate disease, then you'll likely come out of it fine and you will hopefully have protective immunity, but we still don't know that for sure. But it does look like everybody who has been infected is generating antibodies, and now we just need to see if those antibodies are protective. However, some people, about 15%, are sick enough to end up into the hospital, and about 5% are so sick that they need to be in an intensive care unit, about half of whom end up on mechanical ventilation. So this can be a very serious disease for anyone of any age group. So in general, I would not recommend getting the infection as a way to trying to become naturally immune.
So let's expand on that. Dr. Brewer, I am not joking. We probably have, I'm looking at Emily right now, 24 questions about herd immunity. That's right, 24 questions about herd immunity. How does it work, and is it really a thing? Let's talk about herd immunity.
Sure. So herd immunity refers to how easy is it for an infection to spread in a population. So it depends on two factors. One is how transmissible is the infection, how contagious is it, and the second is how susceptible are the people in the population. So if you have a population where everybody has already had measles, then even if you introduce measles again, unless they have failed or partial immunity, you're not going to get any spread, even though measles is very contagious. With COVID-19, we estimate that one infected person on average spreads it to 2 or 3 susceptible individuals. If you do the math, that means that you need to have somewhere between about 60 to 70% of the population having immunity to reach that level where it's unlikely to spread. So that's the level at which you would hit herd immunity. To put it in perspective, a study done in Los Angeles County suggests that about 4.5% of the population has been infected, and a study in Santa Clara County suggested that it was about 2.8%. So we're still a long way from that 60 to 70% we would need to kind of protect us all from spread in the population.
Dr. Brewer, thank you so much. That's Dr. Brewer, UCLA School of Medicine. We're going to go back to Dr. Mays. Dr. Mays is the County Public Health Officer for the County of Sonoma. We have 2 questions, Dr. Mays. We are getting a lot of questions regarding beaches and a lot of questions regarding hair salons and nail salons. So this next question is coming in from Eli. Is there a specific timeline or a specific date when hair and nail salons are supposed to open? Now, that's in stage 3. That's going to need to be in coordination with the California Department of Public Health. Dr. Mays, 60 seconds. When do you see, what does your crystal ball say about hair and nail salons in Sonoma County?
Well, inherently those are going to be more higher risk settings just because you have long exposure in close settings with one other person. And that's the reason why those kinds of personal services are in the stage 3 of the governor's plan. So I think since we're in stage 2A and 2B, pretty much around the state at this time, we'll have to look and see how this goes before the governor will then make a determination on stage 3. So we're all waiting as well to see how we move forward.
All right, Dr. Mays, thank you so much. So a lot of questions in regards to nail salons, hair salons, and now let's go to beaches. We have a couple of dozen questions about beaches. Sonoma County loves its beaches, loves the Pacific. Talk to us about what you see for reopening state beaches. There's been some major progress on parks. Let's turn it over to the Public Health Officer for the County of Sonoma, Dr. Mays.
Well, right now our coastal parks and are open from sunrise to 11 a.m. and from 5 p.m. to sunset. And that's mainly for people who live on the coast, so residents of the coastal areas. And that's because we want to see how that goes first. As you know, in Sonoma County, we are a destination for people in the region for our beaches and our coastal parks. So at this point, we're monitoring the progress on that. And as you see, we've been moving forward on our parks and beach opening plan as we see compliance with all of our guidance. And so we'll continue to evaluate and let people know.
Thank you so much, Dr. Mays. We have a two-part question coming in from Colette in Santa Rosa. This first question is going to be for Sheba Person-Whitley, the Executive Director of the Sonoma County Economic Development Board, and then we are going to go to Dr. Mays. The first question from Colette is this: how will the county manage social distance violations and sanitary compliance in establishments? Let's turn it over to the Economic Development Board.
Thank you, Senator. So what we have and what is on the Sonoma Economic Development Board site is a list of mitigation measures. So that really gets at Colette's question. We really do have a high level of confidence that businesses are going to be responsible. They're going to do what they need to do to create a safe environment for their staff and for their customers. We have a self-certification site. As we receive guidance from the public health officer and the state with regard to reopening and with regard to what types of businesses are allowed to reopen, businesses will self-certify, attesting that they are taking mitigation measures, creating the distancing, taking sanitation into effect, making sure that their employees are safe before they re-enter the work environment. And so really there's a great deal of trust that we have and confidence we have in the business community. They will self-certify that they have taken those measures into account. And really what we're probably going to see is that the community will police all of us, right? The community, as they re-enter into establishments, as they go about doing business, if they see something that they feel is unsafe, they are probably going to reach out to health. They're going to reach out to the permit department. They're going to reach out to EDB. And so we are not going to be, at least EDB, because we don't do any sort of compliance or regulatory measures in our department. We're not going to be proactively looking at that, but we do have a certain level of confidence that our business community is going to do what they need to do to protect people. And, of course, people are going to report what they see if there's a violation. Thank you.
Thank you, Ms. Person-Whitley. But I think it's fair to say if there is, look, the vast majority of business owners will do the right thing. Let's just be honest about that. But there may and typically are a few outliers. Would it be fair to say code enforcement or local law enforcement would be activated to ensure the public health if there are a few outliers out there, Ms. Person-Whitley?
Absolutely. That is exactly what will happen. So it might be environmental health, or it might be someone from code enforcement, it might be your local police department who comes out to investigate any sort of complaint. Absolutely.
Thank you so much. That's Sheba Person-Whitley from the Economic Development Board. We're now going to go to Dr. Mays, Public Health Officer, Sonoma County. The second question from Colette: how are we preparing for a surge in medical hospitalization cases that may be much larger than we've experienced to this date? If you want to talk about Sonoma State a bit, Dr. Mays, and the preparedness that you've been working on in partnership with the state.
Yeah, sure. First of all, every hospital has their own surge plan, and they have the ability to add up to 35% of hospital beds for COVID positive patients and surge up to that amount. In fact, I think we've hit 38% surge capacity at this point. And then we do have the alternate care site, which is Sonoma State University, the dorms there. We have a contract with them where we are currently housing COVID positive persons until they are non-infectious, and those people who are pending a COVID test when they cannot isolate at home and cannot, for whatever reason, they can't isolate to a separate bedroom, or they have people at home that are vulnerable over age 65 or with underlying medical conditions. So we've already set up the facility for receiving COVID positive patients. We have 2 gymnasiums. One can accommodate 72 persons and the other 24 even more ill persons. So if our hospitals become full, we have the alternate care site for caring for our patients.
Thank you so much. And that was one of the prerequisites that the county needed to be able to prove. Please push back at me if you think I'm wrong, Dr. Mays, to the state. Moving forward with the reopening, the county had to be able to prove that there was surge capacity both within all the hospitals in county as well as Sonoma State. Correct, Dr. Mays?
That's correct. We had to have a surge capacity plan and a plan in case our hospitals fill up and we need to place people in other places.
Thank you so much. We're going to be going first to Dr. Brewer to talk about antibody testing, and then we're going to go back to Dr. Mays. So, Dr. Brewer, talk to us. There are some counties that are starting free antibody testing. So tell us a little bit about antibody testing, what it does, why it's so critical, and why has it been so slow to roll out? Then we're going to go to a specific Sonoma County question on antibody testing to Dr. Mays. Dr. Brewer, UCLA Medicine.
So, Senator, there are two kinds of tests we use for COVID-19. One is to test for the virus or a piece of the virus. That's the NP swab or the polymerase chain reaction test. That is the test that's done when someone has symptoms and we're trying to figure out, are they infected with the virus? That's also the test that can stay positive for weeks after somebody gets better. The antibody test at this point is really a test primarily for public health officials to do surveillance, to try to get a sense of how many people in the county or the state or the country have been infected with COVID-19 to help with planning around the public health response, and also to get a sense of where are we in that level of herd immunity. So antibody testing is really best done in people who you think have had infection in the past, and you want to get some sense, do they have, hopefully, protective immunity or not, or to try to get a sense of the level of infection that's occurred in the population. It is not a test we use right now to look for people who are acutely sick that we're trying to diagnose COVID-19 in.
Thank you so much for that description, Dr. Brewer. We're now going to be turning it over to Dr. Mays. Dr. Mays, this is coming in from Susan. Is Sonoma County able to have a similar situation as Santa Clara, offering free antibody testing?
Yeah, we have procured the ability to do the antibody test. We have the machine. It's being quality assured, and we will be doing surveillance. In other words, as Dr. Brewer just said, we don't use this test for diagnosing active infection with COVID. Rather, we're looking at surveillance for public health to see what percentage of people in Sonoma County may have been infected with the virus over the past 3 months. So we do have plans to initiate antibody testing like Santa Clara soon.
All right. Thank you so much. About how many folks do you think that machine will be able to test per day, Dr. Mays?
I think that the testing can be 100 samples at a time, and my understanding is we can do a lot of samples in a day because multiple runs can be done in a day.
All right, we're going to stick with Dr. Mays, the public health officer from Sonoma County. Dr. Mays, we're going to turn to universities and colleges. When students return, will Sonoma County mandate that they need to have a test before being allowed in the classroom?
There is no plan in place at this time for reopening in that manner, and I think it's really going to depend on what we're seeing over time. In other words, a reopening plan for universities and schools is something the state is considering. So we're going to get a lot more direction from the state on these kinds of reopening plans.
We're going to stick with Dr. Mays, and we're going to go to Dr. Brewer for a statewide outlook. This next question is, how do we get an age breakdown for COVID deaths in Sonoma County? Dr. Mays, can you talk about those data sets and what you're seeing across the county? And then we're going to go to Dr. Brewer to give us a statewide look.
Yeah, so we've had a really small number of hospitalized patients to start off with, and 4 persons who we've reported as deaths. And as I've said before, everybody in our county who has been reported as a death occurred in the over 65 population. So I guess that would be the age breakdown for deaths.
Let's go, that's Sonoma County. Let's take a look statewide. So let's talk with you, Dr. Brewer, UCLA Medicine. What do you see statewide in regards to those data sets of fatalities due to the virus?
So, Senator, there actually are good data on the California Department of Public Health website. If you just type in California Department of Public Health COVID-19. It'll take you right to their website where it'll start with the numbers, and then you can hit on a little button that will take you to a breakdown of all the deaths by county and by age. So, for example, Los Angeles County has had 1,913 deaths. Riverside has had 274 all the way down. As Dr. Mays mentioned, Sonoma County has 4. It also gives you a breakdown of deaths by age. So we have had no deaths in individuals under the age of 17, and only 6% of deaths have occurred in individuals under the age of 50. So the California Department of Public Health website is a great source of information about the state of the pandemic in the state.
Appreciate that. Thank you so much. That's Dr. Brewer, UCLA Medicine. We're now going to be going over to Sheba Person-Whitley. She's the Executive Director of the Sonoma County Economic Development Board. This next question is coming in from Barbara in Hillsburg. What are the specific recommendations regarding house cleaners returning to clean? Safety protocols, masks plus distance, of course. Anything else that folks should be talking with house cleaners about? This is coming in from Barbara. We're going to turn it over to Sheba.
Yeah, thank you. So great question, Barbara. So the mitigation measures and the standards that we have are developed here by businesses in the county, as well as looking at what the state has put out. Certainly PPE is on high on that list, so thinking about facial coverings, thinking about opportunities to create distance as well. So our recommendations is really to, even if you're in the home when someone is coming in to clean, to make sure that you are still having physical distance between people. Sanitation is really important as well, using proper sanitation equipment. So I think it really is all about what we've heard, not only Dr. Mace, but other public health officials state, is that it's about distancing, it's about making sure that you have at least 6 feet of distance, making sure you have those facial coverings, and making sure you have really great sanitation. So whether that is gloves or washing your hands for at least 20 seconds.
Thank you so much, Ms. Person-Whitley from the Economic Development Board. Dr. Mays, quickly, anything that you'd like to be able to add to that?
No, I think that Sheba has pretty much covered that.
All right, thank you so much. We're going to go back to Dr. Brewer. Dr. Brewer, let's talk about the coronavirus spread. Dr. Brewer is from UCLA Medicine. This is coming in from Boris. Boris asks, please speak to the new data suggesting that COVID-19 transmissions are coming from respiratory droplets and not from surfaces. And how does that change reopening requirements and child-to-child transmission in camps and schools? That's coming in from Boris. Dr. Brewer.
So, Boris, respiratory droplets has always been the primary way that COVID-19 has spread. And in fact, when you're talking about surface transmission, that's still from respiratory droplets. So what happens is someone who's infected with COVID-19, when they talk or sneeze or cough, they produce those respiratory droplets that travel 3 to 6 feet. If they tend to land on a surface, then those droplets with virus might survive for anywhere from minutes to hours, as I said. If you then touch the surface and there's still viable virus there, it can get on your hands and get from your hands to your nose and your mouth and lead to an infection. That's why cleaning surfaces and disinfecting them is so important. But respiratory droplet spread is the primary mode of COVID-19 spread, always has been. That's why we keep stressing the physical distancing, the stay at home when you're sick, and wearing the facial covering to keep those droplets from getting out and spreading to others.
Thank you so much, Dr. Brewer. We have one additional question coming in regards to spread, and this has to do with mail-in ballots. Look, my belief is when we start marching towards this November election, it's going to be safer to have mail-in ballots than have individuals congregating around polling stations. But there's some concern that are coming in about touching mail-in ballots, and if the coronavirus could spread from that paper of the mail-in ballot. So can you talk to us about that and set the record straight, Dr. Brewer?
Sure, highly unlikely. So viruses don't survive outside of their hosts for very long. So unlike a bacteria, a virus cannot survive on its own outside of a host cell for a very long period of time. So that by the time that ballot is mailed, travels through the mail, gets to your house, and you pick it up, no way the virus is going to be alive. But if you're at all concerned, all you need to do is just wash your hands. And the soap and water, particularly the soap, will disrupt the envelope of the virus and take care of it for you. But do not worry at all about your mail-in ballots. The virus will not survive that long outside of a host cell, the amount of time it takes the ballot to get from wherever it comes to wherever you are. And do please vote. It's so critically important that we all exercise our democratic rights.
Especially this year, Dr. Brewer. You are absolutely right. Thank you so much, Dr. Brewer. This is coming in. This next question is going to be for Dr. Mays, the Public Health Officer for Sonoma County. Rias asks, what are the 12 metrics triggers that will raise red flags during reopening that will lead to more restrictive measures if needed? So if we're moving along, Dr. Mays, the economy is reopening, what will make you hit the pause button? What are those triggers?
Sorry, I was muted there. Fantastic question. I can go through all of them for you, and they really pertain to the initial metrics that we had selected. So we're going to look at the rate of cases per 10,000 population. Right now we're at about 2 cases per 10,000. And if we hit 4, that's double the number of cases per 10,000. That would be one measure. There's a case fatality rate. We're at 1%. If we hit 5%, that would be a red flag. The proportion of cases due to community exposure is currently 19%. If we hit 30%, then that would be a red flag. Contact tracing staffing. We currently have about 70 people, the volunteers following contacts. If we end up with less than 75 or fewer than needed to manage our contact tracing needs moving forward, that could be a trigger. Doubling rate of cases would be a trigger. Percentage of positive tests, currently it's at 3.4%. If we're over 8% per the state criteria, that would also be a trigger. The volume of testing, if that drops to significantly under what we're doing, we said 750, that would be a trigger. Percentage of cases ever hospitalized is currently 9%. If we hit 15%, that's a trigger. Proportion of cases in over 65 is currently 14%. If we hit 21%, that would be a trigger. Number of cases in skilled nursing facilities is 0 currently. If we hit 5, that would be concerning. Currently, number of cases in homeless populations, ventilators available, hospital census, ICU bed availability, PPE supply in hospitals and nursing facilities. Those are our criteria.
All right. Thank you so much. Very grateful, Dr. Mays, for that in-depth look. We have a few minutes left, ladies and gentlemen. We have quite a few questions coming in, and we're still over 1,000 strong on the line. We are so grateful that you've been sticking with us. We're going to go to another question. This one is coming in from Garrett. This is for Dr. Brewer. Dr. Brewer, you covered this briefly in your introduction, but I'd like you to cover it again. Garrett asks, why does the CDC talk about a fall spike in coronavirus cases? Dr. Brewer.
So, Garrett, the concern is that COVID-19 is still spreading around the world. It will still get reintroduced into the United States and into California. And in the fall and the winter, we tend to congregate closer together and we spend more time indoors. So we tend to see respiratory viruses like coronaviruses and influenza spread more in the winter months than in the summer months when people are more likely to be outdoors and farther apart. So the concern is because COVID-19 will not have gone away and because we are unlikely to have a vaccine, as we start to move indoors again, spend more time together, we could see more cases. That's why maintaining the physical distancing, face shields, and the other things we've been talking about will continue to be important throughout the summer and the fall.
Dr. Brewer, thank you so much. Dr. Mays, we're going to go into lightning round. We're coming up to our time, but let's go into lightning round of questions, Dr. Mays. So first and foremost, we have had numerous questions about reopening of schools. I'll comment, and then Dr. Mays, I'll turn it over to you. When it comes to reopening kindergarten through 12th grade education, there is still numerous discussions being held at the state about what this could potentially look like. There will not be a quick decision, meaning over the next week. I do not believe that we're going to see guidance from the state about what fall will look like when it comes to K through 12 education. There's going to be continued discussion with the California Department of Public Health, the California Department of Education, and of course taking input from local public health officers. I'll turn it over to Dr. Mays. I wanted to make sure we cover that because we're getting a lot of questions, Dr. Mays, rightfully so, of parents who want to be able to get a better understanding about schools. I'll turn it over to you quickly, Dr. Mays, and we'll go to a lightning round.
Yeah, I think it's a great question. I think the state is very aware that they need to provide guidance for schools, and soon, as people are asking questions. So we're waiting for the state to give us guidance, as it would be better than having each county come up with their own guidance. Having said that, we are in constant conversation with our superintendent of schools.
Thank you so much. All right, Dr. Mays, we're going to do lightning round here as we are coming to a close of our town hall. We're getting a lot of questions about funerals. Funerals would be in stage 3, the next stage. You are dependent on the California Department of Public Health. Folks are asking you to look into your crystal ball. Are we talking months away, or are we talking weeks away? Dr. Mays.
Again, it really depends on what happens with the stage 2 reopening. So everything that we do should be based on what we're seeing moving forward with what we are reopening. So I think we need to give it some time, having just reopened a bunch of sectors, to see what the impact is before we move on to the next round.
So candidly, Dr. Mays, what you're looking at is we've reopened with stage 2. You're looking at, are we seeing enhanced number of coronavirus cases? If not, it may be safe to go to the next phase. If we are, we may be holding steady. Would that be accurate?
Exactly.
Dr. Mays, there's been quite a few questions about drive-in church services. What is your opinion on drive-in church services?
Yeah, I believe that that's a lower risk activity. In fact, it's one of the things that has been posted as something we've asked for our next step from the state. And as I noted, we should be hearing here shortly from the state about moving forward with that.
Dr. Mays, I appreciate you doing this lightning round. We're going to go to the next question about tasting rooms. There has been movement with the wine industry, but the challenge has been Napa County was denied tasting rooms, and please push back if you think I'm wrong. It's because there's concern about how many folks would be in the tasting room and the actual tasting from wine glasses and potential food. So there's continued concern from the state. I'll turn it over to you to comment on wine tasting rooms. It's so critical to our economy in Sonoma County.
Yeah, and that's definitely part of our ask for the next round here. Again, we're waiting to hear from the state. There may be some a limited reopening with some stipulations. We're waiting to hear at this time, so stay tuned.
Thank you so much, Dr. Mays. The last question for you, Dr. Mays. How many positive coronavirus cases are coming from healthcare workers? Dr. Mays.
It's been anywhere from 20 to 30% of our cases. Early on, we had seen more but cases in healthcare workers, let's say, mostly related to travel, conferences, things like that. But so it's been always somewhere around that 20% to 30% range, and now it's closer to 15, 20%.
Thank you so much, Dr. Mays. Final question for Dr. Brewer. Dr. Brewer, a lot of questions tonight about masks. And what is the best way to be able to kill the coronavirus on masks and clothing? So if you iron your clothes in your mask, does it kill the virus? If you steam it, do you need to wash in a washing machine? Can you set the record straight on masks and clothing and the coronavirus, Dr. Brewer, UCLA Medicine?
So the short answer, Senator, is all of the above. So washing the virus in the washing machine with a detergent should kill it. Ironing it probably The only concern there is getting all the folds and making sure you got contact of the hot iron on all of the cloth, but if you could do that, that would kill it as well. But just washing, if it's a cloth mask, just washing it in your washing machine, particularly if you do it on hot water, will be fine.
Thank you so much, Dr. Brewer. We appreciate you being with us. Final question for Dr. Either, Chief Economist at Sonoma State University. This is coming in from Brian. Brian says that you said the worst-case scenario for unemployment will be 16%. What is your opinion on that figure?
I think it's a little low. That 16% is at the national level, which tends to be relatively between California and Sonoma County. But we will see. I think it's a little low. A lot is going to depend on the next couple of months and how we reopen.
Thank you so much. So, Dr. Either, you say it's low. What would be your gut then when it comes to the peak unemployment that the state will face?
I think the state will creep up on 20%, but it really depends if you're looking at it monthly or quarterly. And if we start to open the economy up in the next few weeks more and more, it'll keep us from getting to those serious peaks like over 20%. But we might just scrape up around 20% before this is all over.
And you think that peak will be in the first or second quarter of 2021?
No, that peak should actually happen in the next couple of months if everything goes correctly on reopening.
Thank you so much, Dr. Either, Sonoma State. Final question for Sheba Person-Whitley, Executive Director of the Sonoma County Economic Development Board. This comes from Griselda. Griselda is an owner of a restaurant. If she is unable to access masks or hand sanitizers, how can she get her hands on protective equipment? Can she go through the Economic Development Board? That is from Griselda in Santa Rosa. Let's turn it over to Ms. Person-Whitley.
Thank you so much. Great question. So the county is in the process of compiling a resource list for PPE, and what it's going to end up looking like is just a list of vendors that we know have the ability to source that and get it to people quickly with fair pricing. So we hope to be able to have that list up within the next few days, and it will be on the Sonoma County EDB site.
We want to say thank you so much to Sheba Person-Whitley. She's the Executive Director of the Sonoma County Economic Development Board. We want to say thank you to Dr. Robert Either. He's the Chief Economist for Sonoma State University. We want to say how grateful we are to Dr. Mays. She is the Sonoma County Public Health Officer. And, of course, Dr. Brewer, an infectious disease doctor with UCLA School of Medicine. We want to say how grateful we are to all four of you for being with us tonight. Our goal of these town halls over these past 8 weeks has been able to provide you with the latest information from those individuals who are in the front lines combating this virus. And we so appreciate all of you tuning in. You can tune in to our Facebook page tomorrow or our Senate website for a full recording of this broadcast. Should be up on Thursday afternoon, May 21st. Again, thank you all for joining. Thank you for your engagement tonight, and we look forward to working with you here in the weeks and months to come. Sonoma County, stay strong. We're now going to be ending this broadcast. Thank you for joining.